Hello, my name is Matthew Gashton, and today I'm going to be talking about scanning a bony pelvis. The clinical indications for a bony pelvis exam include pain like hip pain or pelvic pain, a hip fracture, avascular necrosis, arthritis. Sometimes it's done before operation for prostate cancer to look at the extent of tumor invasion, and it's also done to identify masses, cancers, tumors, or mets. For the test to get the patient ready, we'll get a patient history. We'll go over what kind of symptoms they're having, why we're doing their exam. We'll go over the screening form with them, so we'll check to make sure that they don't have anything that can't go in the scan room, like pacemakers or aneurysm clips. We'll also check to see if they have any implants or anything in their hips that might be a problem for imaging, any metal. After the screen form is done, if they're clear for their scan, then we'll have them change into clothes. We'll give them some scrubs or other hospital clothes to change into, and then we'll have them put their stuff away and make sure they don't have any metal on them. For this test, the patient's going to go into the scanner feet first. They're going to be laying on their back with their legs flat and extended with their feet inverted. We'll give them some weights or some sandbags around their legs to help keep their feet in that position and keep their legs from moving during the test and causing motion artifacts. Their arms are going to be folded with their hands on their chest to prevent their hands from entering the field of view. We'll landmark the scanner at the anterior superior iliac spine, and we'll use the torsal or cardiac coil. Looking at the coverage for the axial, we're going to cover the top of the iliac crest and go all the way through the ischial tuberosities. For the coronal, we're going to cover the anterior superior iliac spine all the way to the posterior sacrum. And then for the sagittal, we'll cover both iliac crests and make sure to include all of the bony pelvis. These are the sequences we're going to run for a bony pelvis. There's 5 regular sequences, and then there's 3 more of contrast is being administered. First sequence is an axial T1 image. This image is good for looking at the bony anatomy and surrounding tissues, also useful for detecting bone marrow abnormalities. The next sequence is an axial T2. This is useful for detecting inflammatory processes, abscesses, or masses in the pelvis. Next picture is a coronal stir. This will help us evaluate the bone marrow and soft tissue of the pelvis. It's also useful for detecting bone marrow edema or inflammation. Next is a coronal T1, also a useful image for looking at the bony anatomy of the pelvis. Sagittal T2 is going to help evaluate soft tissues surrounding the pelvis. If we're administering contrast, next we're going to do an axial T1 pre-contrast with fat saturation. This is going to help evaluate the bone anatomy and surrounding tissues, and then this can be used with the post-contrast images for comparison. Next is the axial T1 post-contrast, same parameters as the last image, with fast saturation. We'll compare these to the pre-contrast images, and the contrast will help enhance and evaluate any lesions or tumors. Last sequence is a coronal T1 post-contrast with fat saturation. This will also be used to enhance and evaluate any lesions or tumors and just give a different view of them. Look at some of the pathologies we might see when we're doing a bony pelvis. One common one is avascular necrosis. This is the death of bone tissue due to a loss of blood supply to the bone. You can see in this coronal T1 image that the vascular necrosis appears hypointense. You can see it developing kind of towards the top of that hip bone. On the T2 images, it would appear hyperintense. Next pathology we might see is bone mets. So in about 80% of cases, the prostate cancer size and metastasize. These will appear as lesions, hypointense lesions on the T1 axial images and hyperintense on post-contrast images. Another pathology we might see is a hip fracture. You can see on this coronal T2 image, kind of around the lesser trochanter, there's a nice little crack there where that hip fracture is.